I am Dr. Sumit Kharat. I am neurologist in Pune. Today I am here to talk about epilepsy. Epilepsy is a condition in which a patient tends to have recurrent seizures. What is a seizure then? A seizure is abnormal electrical activity in the brain and its manifestation on the body. So, not all epilepsy are resistant. Most of them are curable or what we call it as controllable with medication. So many patients with proper treatment and adequate medical supervision get control with their seizures. And in many of them, we can actually taper off medications and after that they achieve seizure freedom without medication also. In others, they may need medications for a considerable time. And in those patients, adequate treatment with pharmacotherapy and lifestyle changes are important. In few of the patients, even with adequate medications, epilepsy may not be controlled. In those cases, options like epilepsy surgery in a good medical setting is important option. Other options like ketogenic diet, responsive neurostimulation, and various other neurostimulation techniques are also treatment of choice. So, the main goal of our treatment is and controlling the recurrent seizure, and main modality of treatment for that is anti-seizures medications. So, what are anti-seizures medication? As I told you earlier, seizures is abnormal excessive electrical activity in the brain, and anti-seizure medication help or reduce those abnormal excessive electrical activity, and there is good control of those seizures. Some patients may be treated with only one medication. In others, a combination of medication in adequately supervised setting and good follow-up with the doctor is needed. And with that, they achieve seizure freedom. Apart from medication, lifestyle changes are also important. It is important to take your medication regularly. It is important to have adequate sleep and good lifestyle habits. It is important to avoid all those activity which can precipitate seizures, especially excessive bright light or in those patients who have reflex epilepsy. Whatever stimulates that epilepsy, you need to avoid that. Epilepsy surgery is for the people who don't achieve seizure freedom even with adequate treatment. It is treatment modality in which we remove the area of brain with a proper surgery which is responsible for causing recurrent seizures. It is done in good monitored setting and a team of neurologists, neurosurgeon, epilepsy surgeons and epilepsy EEG technicians all are needed to control that. It is needed only in few number of patients. Other treatment modalities like vagal nerve stimulation, then responsive neurostimulation, deep brain stimulation are also an option. In some patients and especially children, dietary therapy is a good treatment option for those patients which are refractory to medication. Ketogenic diet is an important dietary therapy for such patients. To achieve good control of seizures, lifestyle management and trigger management is important. Good sleep, stress control, avoiding known triggers, and never missing medication is the most important part of treatment of epilepsy. There are few causes of seizures like tumor or stroke or CNS or brain infection. It is important to treat that cause and get evaluated for that cause in a patient with epilepsy. Most of the causes are treatable, and with treatment of the cause, seizures can be controlled. The person with epilepsy can lead a normal life when they take adequate and proper dose of medication, follow with their doctor regularly, and never miss the medication, when they have good lifestyle, when they avoid triggers which causes epilepsy or seizures. It has been found that many good achievers had epilepsy, and epilepsy did not stop them from achieving what they wanted to achieve. and you can lead a normal life. You can pursue your hobbies. There are some important restrictions while you are having active seizures. It is important to avoid driving and potentially harmful situations in which a seizures can be life-threatening, like swimming or climbing to heights. Apart from these few restrictions, most of the avenues, most of the occupations and hobbies are open to people with epilepsy. It is important to know that most women with epilepsy can have normal pregnancy, normal delivery, and deliver a healthy and happy child. It is important to plan pregnancy in patients with epilepsy and have a good consultation with your gynecologist and neurologist also. It is important to learn first aid of the epilepsy, that what are the do's and what are don'ts in a patient of epilepsy, what to do when patient has seizures. It is important to keep away from false belief and alternative medications or alternative therapies in a patient with epilepsy. It is important that co-workers, friends, and family knows about these things. Importantly, epilepsy is not a barrier for meaningful life. With timely diagnosis, proper treatment, and social support, a person can lead normal life and it will be helpful for the person. Thank you.